Welcome everyone to the webinar on the Navigator for Digital Health Capability Models hosted by Digital Square. For those of you who are new to Digital Square connects health leaders with resources necessary for digital transformation. One of the ways we do that is by hosting webinars like these to help our global goods community thrive. So today, as I mentioned, we'll be talking about the Navigator for Digital Health Capability Models. The Navigator helps health systems planners, implementers, evaluators, and funders choose appropriate maturity-based tools for specific contexts and purposes to improve digital health capabilities at the national and subnational levels. Before we get started, just a few quick house rules. This webinar is being recorded and it will be posted on our wiki. We'll also share any slides that are being presented during this webinar. We'll ask that you mute yourself during the presentation so we can hear the speakers, and then please raise your hand during the Q&A to ask a question. I'll be calling on folks to make sure everyone gets a chance to say hello or ask their question. With that, I'm going to turn it over to our first speaker, Adele Wagman, who was a Senior Digital Health Coordinator for COVID-19 at USAID. She provided the strategic direction and funding support for the Navigator and has been a strong proponent collaborative work to build efficiency and reduce duplication. Over to you, Adele.
Thanks, Brenda. Really excited to be here with you all. Thank you, everyone, for taking time from your busy days to join us. And it's exciting to be here sharing out this tool. This has been a work in progress for a number of months. And in addition to thanking our partners at Digital Square for organizing this event, I want to thank Manish Kumar and Liz Millar, who are the two primary authors of this tool and have put in a lot of work to bring it to life, including with a broad range of partners. This is really a wonderful example of co-creation and collaboration, in this case through the Digital Health and Interoperability Working Group. So we've been working closely with a broad range of stakeholders, including the World Bank, the World Health Organization, UNICEF, and a number of implementing partners, and others that I undoubtedly will have missed. So just a big thanks to everyone who has been along for this journey. So as Brenda mentioned, my name is Adele Wagman. I'm a Senior Digital Health Advisor with USAID and the Global Health Bureau. And I'm going to share with you a little bit about how we got started on this path, why we are prioritizing assessments, and how we're moving forward. Thank you. So next slide, please. So, and just a reminder for those who are on to please mute yourselves. Thank you. Thanks, Brenda. So we know from ample experience that data and information are really critical to health outcomes. And that is true at all levels of the health system. Individuals need information about how best they can care for themselves and their loved ones. Health workers need information to understand how best to treat new illnesses that may be emerging. Health systems planners and policymakers and funders need information about how health programs are performing. And none of this is possible without access to data and information. And we know that increasingly those data are coming through digital channels, presenting a really powerful new transformative potential for improving the way that actors at all levels in a health system can access information and use data for decision making. And so this is a photo some folks may recognize. It is of a whiteboard in Liberia during the Ebola outbreak. And I include it here because USAID commissioned a report looking at how data, information, and digital technologies were used as part of the West Africa Ebola outbreak response. And what it surfaced was that digital is not yet everywhere. And even yet where we find it, oftentimes the reality of the way the digital systems are implemented is messy. As you can see from this whiteboard, it's complicated to understand how you can get data from one independent system to another that have not been designed with interoperability in mind, and that can slow down decision making. So we see the potential, and yet we know that we need to be paying close attention to the way that health systems are going through the process of digital transformation to understand both what's working, but also what's not. So we can be really smart and strategic with our investments and good partners to countries as they move through this journey. Next slide, please. So the recommendations in that Fighting Ebola with Information report, which included both recommendations about how best to invest in digital systems, as well as recommendations about how to support the softer side of digital use, how to support institutions and the workforce as they go through this journey of digital transformation. And USAID took those recommendations and embedded them into a series of policy documents that were released last year. The first was the digital strategy, which was looking at the process of digital transformation from a sector agnostic perspective. And then, of course, we had the digital health vision, which hopefully you all have heard of, but if not, we'll drop a link into the chat. And I encourage you to take a look. This is USAID's new vision for how we will structure our digital investments, bearing in mind the lessons that we've learned, such as those captured in the Fighting Ebola with Information report. And you see related recommendations in the USAID Vision for Health System Strengthening policy document as well. Next slide, please. So a really critical component to both the digital strategy and the sector-specific digital health vision is the role of assessments. If we want to partner with countries to help them understand,
you just hit print screen
where they have
bottom right on your keypad,
where they have strengths they can leverage, and where there are weaknesses that need to be addressed. And so the USA Digital Strategy mandates the creation of these digital ecosystem country assessments that are taking a really broad look at country digital systems and capacity readiness, with the goal of moving toward country digital infrastructure that is open and secure and rights respecting and can best serve the development purposes for which USAID makes investments into these systems. Next slide, please. And as a complement to that, we then have the digital health vision, the very first priority of which is that USAID, through its investments, should be partnering with countries to understand where they are in their digital transformation journeys and to think about how we as one funder can be working to align our investments to the specific needs of the country, both leveraging strengths and identifying gaps. And this is a powerful opportunity for, once we have these assessments, for multiple funders to be aligning to specific need areas in a coordinated way. So this is also an important way to enable better funder coordination and collaboration with the countries that they support. Next slide, please. So over the past few years, probably 3-4+ years, a lot of people have had this realization. This is not a new realization. And there has been a lot of effort put in by a wide variety of partners to begin to standardize the way we conduct these country digital health system transformation assessments. And that's good. We need to be thinking about this collectively, and we need to be working together to do so. But we've also heard in the process that this has been a real challenge for ministries of health and their partners, who now face what looks like a maze of somewhat duplicative yet interrelated maturity assessment tools. And it's unclear where to start. It's unclear which tool to use first. And if you've already done some of these assessments, do you need to now do new assessments, for example, to understand what the opportunities are around investments to support the COVID-19 vaccine rollout, as just one example. So this is the beauty of the Navigator. The Navigator is not trying to replace these tools. The Navigator is trying to bring these tools together in a streamlined, integrated, and user-friendly way that enables governments to more seamlessly understand, okay, we've done a few assessments in the past couple of years. Let's look at the data from those assessments. Let's use the Navigator and see if indeed there are still gaps that we need to address. Next slide, please. So this is why we at USAID are excited about the potential of the Navigator. The Navigator won't reach its potential unless it's used. And so I encourage everyone to get familiar with the tool. The next time somebody starts talking to you about doing any kind of maturity assessment, remember the tool, draw on it, talk to others who have used it. And we'll try to make sure we've got at least a comment section open on a website where you can let us know how it's going, because we don't expect that this is the end of the journey. We expect that this is an important juncture in the beginning of the journey, and that there will be opportunities to continue to build out and refine the tool over time. So the Navigator, to sum up, is a critical opportunity to begin to harmonize the way that we do these digital assessments that will help countries be able to track their digital transformation journeys over time, to be able to look over to what their peers are doing and be able to learn from their peers, and from a funder perspective, to be able to align our funding to meet identified and prioritized needs. Part of its beauty is that it is designed to support national capabilities and moves across different health subdomains, and that it does have the ability to acknowledge and use past assessment data, recognizing that this has been a busy space over the past few years. So I will stop there, Brenda, and hand it back over to you, but excited for the next presentations and the conversations to come. Thanks.
Thank you so much, Adele. Next up, we have a recent Digital Square alum. Dr. Carl Lightner is joining us from the World Health Organization, where he's a technical officer for digital health. He has offered leadership, facilitated and supported collaborative tool developments with a focus on digital health standards and interoperability for many years. Carl, over to you.
Thank you, and thank you for the opportunity to share some of WHO's thoughts on the use of the maturity model Navigator and where we see it coming in. And I want to sort of highlight two digital health transformation related activities from the WHO that I think will help drive the transformation, and what I think the most important role here for the maturity model navigators is looking at these types of digital health interventions for member states, is to make sure that those interventions are appropriate for where they are in terms of the various types of maturity, and to ensure that approaches and interventions are feasible for countries to understand any dependencies and preconditions, other additional support that would be needed as these interventions are being envisioned. So to start, the first thing I'd like to highlight are the SMART guidelines. It's an approach that the WHO is taking in terms of trying to digitize the recommendations and the guidelines that are coming out of WHO. So recognizing that the WHO does provide a lot of clinical care guidelines, for example, or public health guidelines. How do we translate these efficiently and effectively into the digital space? We've got some, the current state is that a lot of these guidelines are difficult to use, they're difficult to digitize, it's hard to track, and don't necessarily provide clear guidance on how to make solutions and implement these guidelines interoperable. So the WHO is undergoing a digitization process for guidelines, starting, I think, with approximately 10 health areas, including immunization, HIV, ANC, so across a variety of health program areas, taking existing guidance from WHO and producing interoperability standards and different digital artifacts that help drive that transformation. This will be a routine process of future guideline developments from WHO, is that there will be both the narrative clinical guidance as well as the digital health guidance that accompanies that. So it's a new approach to implementing the clinical and public health and data recommendations, and it's at heart based on standards, code libraries, and algorithms and other operational specifications. We want to ensure that as these guidelines are developed and digitized, that we have the appropriate tooling, support, systems in place with WHO, with other partners and donors, development banks, to ensure that there's to accelerate the uptake and ensure that it's done with high fidelity and aligning to the guidance. So as you can see what the SMART guidelines are and are not, but just to highlight that there are in here implicitly a number of sort of assumptions on the maturity level of countries as they adopt these guidelines. Things like governance, the ability to have to operate digital health infrastructure, to implement the systems and solutions. And so these maturity models that we'll be seeing and the navigator to them can help ensure that the member states have appropriate guidance as to what they need to do when they deploy a digital health solution. The second thing I just wanted to highlight is that there is a global digital health strategy from WHO, and there are a number of strategic objectives. You can see them here. And as member states and WHO works to achieve these objectives and monitor their outcomes, in the digital health interventions that are aligned to these objectives, it's important again to ensure that the feasibility of those interventions is considered, and the maturity model navigators, I think, is a key step in understanding that. So thank you, and back to Verinda.
Thanks, Carl. Next up, we're going to hear from Dr. Manish Kumar, who was the technical lead for the digital health and health systems with the Carolina Population Center at UNC Chapel Hill. He led the Navigator project and provided strategic and technical leadership for the design, development, and implementation of the Navigator. He also led the collaboration with various stakeholders and at the global and country level to jointly create the Navigator. He's going to give us an overview of the Navigator. So over to you, Manish.
Thank you, Brenda. Can you hear me clearly?
We can.
Great. Well, thank you everyone for joining, and Adele and Carl for providing an overview, but also for your leadership. I think we are able to present the Navigator also thanks to both of you. And to many of my colleagues who are in the audience today, if I start taking the name, probably I'll have to read at least 60 of the names here, because at some point of time through the working group, through our country level coordination, you all have contributed. So I may be presenting, but this works, as Adele mentioned, is co-created by many of you who are here. Adele has provided a very good overview of what the Navigator is, or at least what the tools are included. So I'll go through it, and my colleague Liz, who has been involved from the very beginning, as Adele mentioned, will just demonstrate how the tool, the Excel-based tool, can be used. Now I'm using the word tool, and you must be thinking, well, there are 6 tools in the Navigator, and here is another tool Navigator. What exactly is this? I'm sure at the end of the webinar, you will find that, well, it's not that confusing. It's really a navigation that we allow. So it's a decision support workbook, has 3 components. The workbook is the Excel part that we'll share. So why is the Navigator needed? Adele mentioned very well, and I would like to acknowledge contribution of our colleagues in the Asia Health Information Network, who initiated that whole conversation way back in 2018. Also to many of our colleagues in the digital health world, way back in 2017, we started that conversation and created a summary of 6 tools at that time. So all those people have contributed. We're using maturity model-based tools, so it's very important for us to understand what they are. They're very, in general, at a broader sense, they offer a systematic way of identifying characteristics of systems or organizational policies, processes at different levels when you are trying to achieve your business goals or your healthcare goals for that matter. So that's what, when we say maturity, we are looking at your capability advancements. How capable are you to address the questions as of today? What is that you will need in 2 years, 3 years time frame to achieve your HIV, malaria, TB, or any other program goal? So that's broadly what it means. The navigator explains which tools fits your goal. And when I say tools here, I'm referring to the 6 that Adele mentioned earlier, but I'll mention it again. The navigator allows you to ask a question. What is my goal? What is that I want to assess? What is that I would like to improve? And based on that, navigator can point it. It also allows to ask, what should I do if I did an assessment already? All of us are conducting assessment and they're going to continue, more tools will appear. So how do we bring? So navigator, in that sense, is helping to find the best fit for you. And the other question I mentioned, how tools can be used together. Now, this is one question that we often get asked. Are we replacing any tool? Like Adele has mentioned again, no, navigator is just building on the value of each of the individual tools. They serve a very specific purpose. They have their own value. I think the question comes is because many a time they follow a similar framework. Most of them will look at WHO ITE health strategy or any other organizational digital health framework. So they're bound to be similarities. So navigator offers a way to know what are the similarities, and it's a recommendation, as you can understand. But when we looked at this navigator, we largely look at the national level tools. The question that we were asked is what about system specific tools? So there's community health information system, there is lab, and then there is supply chain information system. What happens to those maturity models? Can they fit here? Yes, in principle, they can fit here. Have we focused on them? Of course not. As you can expect, our scope was limited. We wanted to start. So navigator is a very good starting point for this conversation. And I think both Carl and Adele has mentioned how it becomes important to align with your digital strategy goals. So we have worked at least on supply chain information system maturity model, just to showcase an example of how they can align with it. And thanks to our colleagues at the supply chain project, PSM, they're working, and our colleagues at USAID who are involved in that as well. So why is the navigator needed? I mentioned to you, we want to identify our current capacity, but we also want to set a goal based on our program objectives. And we want to know what are the intermediate steps that we'll have to go through to achieve that. So that's one problem. But as we said, there are multiple tools available. That makes it challenging to really decide which one to choose and how do you align those tools to make a decision. So the navigator is an attempt to address some of those challenges that has been raised by many organizations, people in the Ministry of Health. My colleague, Carol Kamasaka from Ministry of Health in Uganda will be sharing their experience, and you'll hear from her. She played a big role in not only allowing us to test, but also explain how it can serve the Ministry of Health. So this builds on the individual maturity models, the ones that are included, but it offers additional value in terms of how to identify and use them one after the another. So navigator has 3 parts, as I mentioned. This slide deck is I would say a summary of what we have included in the navigator. So if anyone wants to introduce the navigator to an audience, that introductory slide deck is a good resource. The second one is a user guide, step-by-step guidance. It also provide explanations of the concepts that are included. And the navigator has an interactive Excel workbook, what we call the decision support workbook, and I'll leave it for later. My colleague Liz will be talking about it. I'm sure you'll find that one the most exciting, probably, or I'm building the excitement. So let's hope that we'll keep that level. Navigator is also guided by the WHO Digital Implementation Investment Guide. This is publicly available, and one of the first steps in the entire process is the review and the planning part, where it recommends some of the tools that are included in the navigator as well. Why use a maturity model tools? I'll briefly mention. Again, maturity is used in terms of your system level capabilities, the processes you have, the workforce that you have, what are the skills and knowledge that they have, how capable they are as of today, what is that you would like to build in the next 3 years to achieve your program goals. So that's what it means. It allows to identify a future goal and then build your capability. So you can see what you have today, And then you can look at what are our goals. And using those two, you can come up with implementation or improvement plan. That's how most of these tools are designed. And that's what it means, why it is very useful. Now, it doesn't leave vague. I will not go into the the design of maturity model, but it provides very good guidance on what you can expect once you make a progress and move to the next level, let's say in terms of your analytics capacity. And the elements that are included here in each of the models, that touch on one of the digital health capabilities that you have, whether it will be workforce, your process, technology, organizational policies, leadership. Those are the ones that you can identify as strengths or shortfalls once you do an assessment. But the important value of this is it also provides guidance on, so if you have a gap, what to do next. It doesn't leave it open that, okay, gap is there, now go and figure it out. No, most of these tools, that's what they do. This is an overview of the process. We started reviewing available tools. We talked with the people who created many of these tools and implemented it. We had an advisory team that Adele mentioned early on that helped us identify which tools to include here. We piloted in two parts. The first phase was more about just testing what goals that you would like to focus on. We revised it. In the second phase, we also looked at, okay, I know my goal. What should I do if I already have conducted an assessment in the past? Can I use some of those findings? So that was the phase two. Now we are in the final phase of disseminating and sharing with people. So these are the 6 tools that are included. Early stage digital health investment tool supported by the Gates Foundation, Global Digital Health Index, many of you know very well. HIS interoperability and HIS stages developed under the USAID Measure Evaluation Project. Information systems for health that comes from our colleagues at the Pan American Health Organization, and the WHO Survey, Count, Optimize, Review, Enable Essential Interventions package. Now, SCORE, one important thing here is SCORE is a technical package. It includes multiple tools. Many of the tools that you see here, like interoperability, you will find in that package as well. What we included here was the technical interventions, essential interventions package, which also follows a similar maturity model approach. The tool selection parameters, as you can see, we focused on the ones that are focusing on the national capabilities, not system specific. So this is again a clarification here. What is the scope? It's not focused on any disease. So these are all national tools focusing on digital health or health information systems implemented by ministries of health in low and middle income countries and available and accessible in the public domain for us to use for this purpose. So these are the criteria that came through various consultations and guided which tool we should include. And that's the reason in the very first meeting, we were asked the question, but what about system specific module? There are other models, and I'll show a visual what we mean by system when we say that. Yes, they can be included. Again, I mentioned supply chain is one example, but we have also provided a brief description about some of the other maturity model tools like AI for Health, one larger digital ecosystem assessment, which is not really a maturity framework assessment, but very comprehensive and how Navigator can align with it. Then there's a digital disaster preparedness tool that is supported by Digital Square and being currently used. We have also tried to explain, and there are many others. I can share a long list that people are interested in asking. Our colleagues at the World Bank has done some very interesting work, and which is one of the benefits that people may also find about the Navigator is if you want to build a customized tool, you know what you want to measure, what you want to improve, but you're looking for validated tools, indicators that you can use for your purpose. So they looked at about 10 to 12 different tools. Some of them are included here, and they created their own customized version that allows you to map with other tools. You can see what you can draw from others and still make your own. And it will help people understand, oh, I can use this in combination with others. So that's something, a benefit that we can have with the Navigator to support other customized or system specific maturity models. While we work with the groups we mentioned, the system specific maturity models, you can see these are very system defined by WHO. We will be having conversation with our colleague in the open HI community, the terminology management. There are people who are also working on EMRs, maturity models, and probably you'll see in the public domain very soon, our colleagues at the Inter-American Development Bank. Those tools are very, very valuable. They can also be aligned with the national one, and that's something that's possible. We have some guidance, not much. Our colleagues in the data use community, which brings various stakeholders together, also were involved. Some of them were involved in testing and reviewing the Navigator. So that's also, you can see how broader we have in terms of our reach while we were creating this. This is the key thing that guides how do I decide which tool to use. So each tool has a specific purpose, as we said. So the Excel-based workbook will help you determine which goal leads to which tool. And then also you can see if you have more than one tool for the same goal, how do you decide between those two or three tools? We'll provide an explanation. There are some additional criteria that you can use. These are the main criteria, the possible goals. I'll skip through it. The reason for that is when my colleague Liz will present, you will see how actually it shows up in the Excel workbook. This section of the Excel workbook basically helps to know, okay, I know what my goal is, but what if I've done 3 assessments in the past? How do I leverage those findings? This is what that section is in that Excel workbook about the previous assessments. Additional criteria, this will come up when you have more than one tool for a purpose. You will have additional criteria to choose from, like the language, the methods, which has alignment, the resources that you have available, what areas you want to focus on in terms of your assessment, leadership, data use, workforce, that will help you determine which tool to basically focus on. So decision support workbook is the interactive part of the Navigator. It will allow everything that I mentioned to the goal, to the previous assessment and criteria. And we will go back to that tool very soon. So in summary, I will say the Navigator is just an initial effort to provide some guidance on how these various tools can work together. How do we choose an appropriate one? And Excel support in the Excel workbook is the interactive part, but I think the user guide provides detailed understanding of some of the concept that is good to understand. And this is something I can mention that some of my colleagues in Nigeria, I know they are in this webinar, also from Ethiopia. They are already looking at how to use it. So thank you for looking into the Navigator. We will be very keen to learn from their experience that how they found it useful, but you'll hear later on also from my colleague Carol about its possible benefits. So thank you so much, and I'll hand it over back to Brenda.
Thanks, Manish. I think you have built up some excitement, judging from all the questions in chat. All right, next up, we have Liz Miller, who is a digital health technical specialist with the Carolina Population Center at UNC Chapel Hill. Liz is a Navigator core team member and played a key role in the design and the testing and the development of the Navigator. She contributed to the content while coordinating with the Navigator core and advisory teams. So Liz, over to you to review the workbook and explain how to use the Navigator.
Thanks, Miranda, and yeah, hopefully I can live up to the hype, Manish. Thanks for the build up. I'm going to drop just a reminder to mute yourself if you're not speaking to help with background noise. Thanks, Miranda. So I'm going to drop the link into the chat so you can follow along with me. As Manish mentioned, I'm going to demonstrate the Excel-based workbook component of the Navigator, but just so you can see what that is. Manish briefly touched on the different components of the Navigator. It's a resource of several parts. Just briefly, the user's guide is the most detailed, in-depth portion of the tool. It goes through a lot of what Manish has talked about in greater depth, including the value of using a maturity model-based tool. Here's the Excel-based decision support workbook. Feel free to download it and follow along with me while I do the demonstration in just a minute. The slide deck is a condensed version of the user's guide, so that might be helpful for groups looking to use the Navigator, more concise version of the information and how to use the Excel-based workbook. And then there is an Excel-based appendix to the Navigator, and that is the detailed indicator mapping, and I'll get to that in just a minute. I just wanted to point you towards all of those so that you know where to find them. Now I'm going to toggle over to the Excel workbook. So this is sort of the exciting part because it's the interactive portion of the Navigator. There's a number of tabs here. I want to draw your attention to that. You may need to toggle through to find all of them. What we have here is a brief overview of what the Navigator is. It points you to the user's guide so you can have a more detailed version of that. It's just, if you were to stumble upon this, so you would know what it was. The instructions tab takes you through a detailed step-by-step of how to use specifically this Excel-based decision support tool. And then the tool selection tab is the interactive tab. So this is the portion that can actually hopefully point you towards a maturity model-based tool that is a best for fit for the purposes of that you would want to conduct an assessment. There's also a tab here with a description, a brief description of the 6 tools that are included in here. Each tool has its own individual tab with a little bit more information as well as a link to the tool. And then there is a tab here about the indicator mapping, and I'll explain what that is in just a moment. So let me go back to the tool selection. I'm going to do just a couple examples to show you how this works. Again, you'd want to read through the instructions and everything before you dove into this. But the main criteria here that the navigator uses to point you towards a maturity model-based tool is the goal of conducting an assessment. These goals that are listed here, there are 9 goals, and they align very closely with the intended as prescribed purpose of the tool. So why was that maturity model-based tool created? What purpose does it intend to serve? And these align most closely with those. It might be a little bit more broad, excuse me. Like for example, you might be able to use one of these tools to loosely accomplish all of these goals. But these, we really want to point you towards what is the best fit tool for your goal. So for example, if my goal is to develop a digital health or e-health strategy, I know that that is my main goal. That's what I want to accomplish with the results of my maturity model-based tool use. I'm going to check the box that aligns with that. You see it'll highlight red for you. You can select up to 2 goals. I'm just going to select 1 in this case. And then the second question you'll need to answer is, have you used any of the tools in the past 2 years? So for this example, I'm going to say no, I haven't used any of the tools listed here. So I will select none. If you don't select an answer down here, the tool will prompt you to check one of those boxes. And then I will select the process button down here. Oh, and I forgot one of the key steps here, and that is that once you download it, even after you save it to your desktop, you will need to enable the content so that the macros run. So now that I've done that, I should be able to hit process. So I get a little pop-up message here telling me the goal I have selected aligns with 2 or more tools. So please select additional criteria below to identify which tool is the best fit. So if I look, and you may have to toggle back and forth a little bit. If I look, it tells me the 2 tools that most closely align with this goal that I've selected and what goal that was to develop a digital health or e-health strategy. Those tools are the GDHI and the edit tool. If you want the longer name and not the acronym, you can select these tabs below to find that, or it's down here in the list of tools used in the past. But you can also see that the tool has auto-populated some additional criteria for me to select. So I need to select 1 additional criteria. I don't need to select an option under each of these 3 additional criteria. So we can see additional questions. What language will the assessment be conducted in? So perhaps I need a French assessment, so I need something that's available in French. Then I could select that, hit process again, and it would give me, if one of these tools is available in French, it would let me know that. What assessment methods do available resources support is another question. So maybe you have a very limited amount of resources. You only have enough to bring in a few key stakeholders and do like a half-day workshop. So maybe you'd want to select that. And then what building blocks are your priority areas to assess? So you may know that you need to look into the ICT infrastructure, or you want to make sure you have an assessment that covers data quality and use. All of these assessments do not cover that in detail, so you might select that. I'm just going to choose 1 additional criteria here, and then I'm going to select process again. And you can see that based on that additional criteria, well, this is telling me that both of these tools meet my additional criteria. So I probably want to look at them more closely to determine which is the best for fit. Had I selected French, this tool would have told me the GDHI is the best for fit goal because that tool is available in French, whereas the edit is not. So now I'm going to go back and reset this and do 1 more example. Something else you can do once it gives you an output like I just showed is to save and close. You can close a version of that workbook and then start a new instance if you want to make sure you don't lose what the recommendation was. So I'm going to do one more example here, and that is if my main goal is to develop an HIS interoperability strategy, and I know that. So then I will check this box here. Have I used any of these tools in the past? Yes, I have used GDHI and I've used the SOCI, Stages of Continuous Improvement. So I've responded to both questions and now I'm going to select process. You can see that here's a pop-up message telling me to look at the red tabs for additional information on previous tool use used. You may notice that we don't see any red tabs that have popped up. That's because they're at the end here. So just a reminder, if you're not seeing what you think you should, you may need to toggle back and forth a little bit. But there is one tool that best aligns with my goals. Select the IMM tab, that's the Interoperability Maturity Model. Select that tab for more information about this tool. It did not prompt me to select additional criteria because it was able to recommend a tool based on my main goal. And in this case, we've also been given some additional tabs with the indicator mapping. So what this is based on the fact that I have used the Global Digital Health Index in the past. I can now look at how those indicators map to similar indicators in the interoperability maturity model. So that allows me to see how similar or different these two tools are, and can I pull from previous assessment results to inform my new or planned assessment. Similarly, for the stages of continuous improvement, since I've used that one, this is also giving me a one-on-one indicator mapping of those specific components. So how does SOCI measure HIS leadership and coordination? Well, that is a similar indicator to how the interoperability maturity model measures governance structure for HIS. This may not allow you to directly draw from one tool to inform the other, but you should be able to at least consider the results from past assessments. And maybe you will only need to complete part of the interoperability maturity model sections that SOCI can inform. So you would need to look at that more closely, and there's additional guidance on that in the user guide. And once again, if you go back to the tool selection page, you can save and close that output so you can make sure that you don't lose that. And I will just make one more comment on the indicator mapping that I showed you. So these detailed indicator mappings down here, that's what the additional Excel appendix is. It contains the one-to-one indicator mapping from all of the tools. So there's a number of tabs there, but folks who are really interested in the details of that may be interested to look at that appendix. So thanks very much, Varunda. I'll pass it back to you.
Awesome, thank you, Liz. All right, last but not least, we're going to hear from Caroline Kamasaka, a digital health specialist with the Ministry of Health in Uganda. She has over 10 years of experience leading design, planning, rollout, and synthesis of learning from digital health interventions in Uganda and other sub-Saharan countries in Africa. She supported the design and the pilot implementation of the Navigator. Carol, over to you to provide us with some ministry perspective and especially about how the Navigator was used, pain points and challenges.
Thank you, Virunda. Thank you, Amila, Manish, and the previous speakers. Good evening, good morning, good afternoon, everyone. It's, of course, evening here in Uganda. And I'm really privileged to be here and part of this exciting conversation about the Navigator. First off, Uganda is at the beginning of implementation of digital health solutions. And because of this, we have very many digital health solutions that have come up for implementation at all levels, from the community health facility. We have tools which are disease specific, program specific. And with this, it really became a challenge at the beginning to identify which tool is actually fit for what implementation and at what level. And then came the assessment tools to determine which of these is fit for this. So, and this came up and were really so many also, which also became a challenge for us to pick out which tool to use to assess these digital tools at the various levels. So when the Navigator came in, it was really exciting, and it has actually helped us to test, but also to evaluate which tools can we use to measure the viable tools for our implementation. And it's been exciting for Uganda, and I want to appreciate Manish and the team at Digital Square, at Path, and USAID for all these initiatives, and to Uganda as a country, as one of the countries to test the Navigator. And I've taken part in its development. It's quite an interesting tool, but also working with Manish is really quite challenging. He's really full of so much knowledge, and he gets intrigued with various digital health implementations. And for me, it has been an eye-opener. And I keep joking about this, and I also mentioned about it during the past Helena conference, and said, I hope we'll not come up with another navigator of the navigator. And we have a maze of these very many navigators now to find out which navigator tool to use. So my call is to everyone out there who is developing these assessment tools. And the beauty about the navigator is that it's accommodative of the assessment tools out there. We already have about 3 or 4 that it has accommodated within its development. And I want to believe that it's accommodative of any other assessment tool that will be coming up. And I'm calling upon the developers not to develop another navigation tool, but to work with the current team, to work with Manish, to ensure that we harmonize these tools and do away with duplication, do away with the heavy burden. It becomes a burden for us, the implementers and policymakers, to put up with all these tools, tool after tool. We start from the digital tools to implement, then we go to the assessment tools to assess these tools that we want to implement. Now the navigator to assess these assessment tools. So I want to request that we work with this tool. We focus more on investing in improving this tool and ensuring that it works across all these countries, across all these other assessment tools, so that we don't have to create another navigator to navigate these tools. So thank you so much. And I've been privileged really to share our experience as Uganda Review. Over.
Carol, thank you for all those wonderful thoughts. I'm going to open it up to questions. Mark, I see that you have one in the chat. Do you want to come off mute and ask it to the panelists?
Sure, Verena, can you hear me okay?
Yep.
Great. Yeah, thanks so much. And Carol, thanks. I did acknowledge you in the comments as well, but just thanks to all of the presenters for such a fantastic session today. This is the topic that's near and dear to me as we try to put out policy and guidance from the PEPFAR coordinating office. You know, trying to point country teams to assessments has really been a maze for us. And it's been really trying to understand, you know, the advantages and disadvantages of each one. And so this has taken that so much further, and just want to applaud the efforts of the very broad team behind this. I did also, I think a lot of it's just in the comment there, but, you know, in PEPFAR, we do a lot with routine data. So looking at trends, you know, there's a lot of interest in, of course, going down into the details and understanding, you know, a specific implementation or specific program area. But, you know, we've really been much more focused on understanding trends in our data, understanding trends and investments. And so I'm just curious if and I know the presenters have thought about this because you're also involved in the Digital Health Atlas work and the map and match activity from USAID, and then of course this digital health investment inventory data stream that we're starting up in PEPFAR, but really looking to help us more routinely monitor where we're making investments, who is funding that, where is it happening, and doing all of this so it's mapped to the system categories and the things that we're looking at sort of global and country level. So just curious if there's been any sort of thought already for, as Carol was saying, in a next iteration, and I couldn't agree more with Carol, like how do we use this as an opportunity to make sure we are aligning the tools, aligning the authors of the tools, making sure there's good fit for purpose, and focusing on those that have, you know, a good alignment there, but also really seeing about how we complement that with routine data that may be coming at a higher level. So just curious about thoughts from the presenters on that. And thanks again for the great session.
Mark,
I can,
just to
go ahead, Carl, and then I'll follow you.
I put a short response in chat, but I do share your understanding of the needs here, and I think it's worth looking at the Digital Health Atlas as a potential place to store some of these assessments. Of course, with member state approval to do so. We already do link to the Global Digital Health Index assessments within the Digital Health Atlas, so I think there's some precedent there. And I do think, more broadly, if there is an opportunity to take the Excel version of the Navigator and digitize that in a web-based form, that the DHA could be a potential home or at least link to that, and keep it front and center there as to help better understand what those assessments are and how to utilize them and inform country investment roadmaps. Over.
And I was just going to add, I love the question because I think there's probably a good hour worth of conversation embedded in it. There's so many different component parts, but I'll speak to what has me excited about this work in this moment in time. And that is that one of the biggest barriers to better coordination of investments has just been a simple lack of shared access to information. And now we're seeing new platforms coming online and new tools coming online that can address that gap, whether it's the Atlas, the new WHO Digital Tools Clearinghouse. And overall, it's indicative of the fact that we're trying to harmonize in light of this move toward national level digital health strategies and plans, the way we as a diverse group of different stakeholders, whether we're funders or implementing partners or multilateral organizations or some combination, how we do these assessments, what investments we are making and being able to share that, and including through using which tools. And so I think we're getting down that path, and we see these information sharing hubs and these decision support tools coming online that will help advance that journey. But it's also good for us to be asking the questions that we can't yet answer, like, where do these assessments live? And I'm thrilled to hear that maybe that place in the future is the Atlas, because that is exactly the kind of common information sharing resource we need to better undergird and support this coordination. Thanks.
Good problem, Adele.
I'll quickly add, I think, Mark, thank you for asking that. This is something, even before we started working on the Navigator, we have been asking, where do we find all those assessments that these tools, the 6 tools, I'm sure at least there are 20 assessments minimum that were done with these assessments. So we have a tab where we included where these tools have been used. So I think there are 30 or 40 assessments, but can we find those reports? Probably for most of them, no, for various reasons, because most of them are with Ministry of Health. There is no approval yet, so they're not in public domain. So, but again, what Adele and Carl are saying, if you're able to make it available in the DHA, it will do a lot of service, and Carol will not have to build another Navigator just to figure it out. Thank you.
Thanks, Manish. Dan, I see a question from you in the chat as well. Do you want to ask it to the team, or come off mute and ask? No worries. So the question from Dan is, how can this work synchronize with the new total cost of ownership work that Digital Square is also supporting?
Partly I'll say that I can talk about it. The reason I can talk about it, I believe, Dan, this work is done by the Inter-American Development Bank, or I don't know if, so there is a similar work that they are doing. So there are 2 pieces of work. They're also doing a total cost of, I'll figure out what they call it. So there we have been involved, but they're focusing in the Latin American and the Caribbean countries. So Carl, probably it will be good to see if they're both similar or they're different. If they're different, then we'll have to align with it. But we work with the Inter-American Development Bank, or at least I work with them to share with them what we're doing in Navigator. And I don't think that tool is yet finalized, but at least we explain to them what Navigator will do and how their tool will be similar or different. So there is at least some relationship there we'll be able to explain. But the total cost of ownership touches on some of the aspects that many of these tools, including the Navigator, are also going to address. So later on, we may have to add on a description, but yes, there is a coordination, at least I can say that part. But Carl, go ahead. Sorry, Brenda, you or Carl want to talk about?
Thanks, Mitch. I had trouble getting off mute, Brenda. Sorry about that. I think this is new work that's just come out from Digital Square and Vital Wave that was supported by USAID. So, you know, Adele's hands are everywhere. And so I think it's actually really important and good work, because just having the assessments, it makes it difficult to lead to real decision making, especially since, you know, people in this group tend to be focused on Ministry of Health, forget about Ministry of Finance, which is where the money is actually coming from. And we need to be working across those ministries in order to be effective in digital health. So I think it's important work and important to bring together. I'm sure as many groups are trying to do it, including World Bank, and bringing that together is an important step. Thanks.
Dan, we have a few more minutes left. I don't see any more questions in the chat. So anyone want to raise their hand? Any burning questions for the team?
Well, maybe this is an opportunity for me to correct verbally my omission at the beginning, which was that I neglected, Carol, to thank you for all of the work you and your colleagues have done to directly support refining this tool. I think from the beginning, that was a key success determinant for us in thinking about this tool is it responsive to the needs that are being identified? And is it working in as intuitive and user-friendly a way as possible, given that the genesis of the tool was a request from Ministries of Health at that AHIN meeting in 2018 that Manish mentioned. So my apologies for that oversight, and thank you so much. And I do hope, like I said earlier, that this is just the beginning of this conversation around the use of this tool, and that there will be more conversations like this, and that additional funders will step in if there is the need to continue to build out this tool. I think USAID would love to see other investors support that process. So thank you, and Brenda, back over to you.
Thanks, Adele. I have one from Timor who has just come in. Do you support country digital health teams directly without going through consultancies or other NGOs? This will give more ownership to this idea. So I think maybe Manish or Liz, you might want to tackle this.
So it's about the use of the Navigator.
Yeah.
Okay. Yeah, so we can say that, you know, this work has been part of the Maturity Model Small Working Group, which is open, anyone can join. And we have been trying to encourage people to come in because this Navigator was developed throughout, you know, participation of the group. So yes, if you want any technical assistance and support, I would recommend that please join us in that group, because we can share and present and, you know, respond to your questions, which is not, I would say it's not a consulting, but it's a voluntary group that is available. And many people know the Navigator, so they will be available to help. So please feel free to join that group.
And I'll just add that we're hoping that the level of detail and what's available in the user guide and the decision support workbook will enable users to not need a ton of support or not need a consultant. But as Manish said, we're happy to provide, you know, to a limited capacity support in understanding and using the tools, or the resources rather.
Excellent. And how do we join this group if we want to?
So I'm just, if this is a question about the Digital Health and Interoperability Working Group, I'm just furiously typing away in the chat box to add my email address. People can email me. Yes, thanks.
Excellent. Perfect. All right, we are at time. I'm going to wait till Adele finishes typing so that everyone gets a link to that group. Adele's email, perfect. And with that, I will just say thank you very much to our panelists for joining us, or for walking us through the Navigator. This was an excellent learning session. And thank you to all of our attendees for joining us and asking great questions. It was a pleasure. Thank you all.
Thanks so much, everyone.
Thank you.
Thank you.
Thank you.
Bye,
Bye-bye.
everyone.
Thank you, Carol. Thanks, Adele, Carl.
Thanks so much to you, Manish, and to everyone.
Thank
Thanks,
you,
Brenda.
everyone. It's wonderful.
Bye.